So I'd like to ask Dr. Allan Just to join us at the podium.
Good morning. So my name is Allan Just. I'm an environmental epidemiologist at the Icahn School of Medicine at Mount Sinai. And I'm going to be speaking not on the infectious disease part, but I'm going to be talking about more about the exposure science, tapping back into that idea of using satellites for the external exposome, and talking more about how air pollution and extreme temperatures can impact human health. So I'm going to talk a little bit about how a changing climate can impact those environmental exposures, how we're using satellites, some of the epidemiologic approaches, talk a little bit about future directions and other applications. We saw a version of this figure where we have the components of climate impacting environmental exposures. And here I'm going to talk specifically about extreme temperatures and air pollutants. So in the New York City area, we're going to have an increase in the frequency and severity of extreme temperature events, and that has impacts directly, and then it has indirect impacts because of the way that climate can impact air pollution, for example. So there's many types of air pollutants. This is a list of some of the major kinds of air pollution that are talked about. Some of them that are regulated by the Clean Air Act are known as criteria air pollutants. And many of these are the result of the combustion of fossil fuels, which are also contributing greenhouse gases and exacerbating the climate crisis. So I'm going to speak primarily about fine particulate matter. So we heard already the term PM 2.5. These are very, very fine particles. They can get deep into the lungs, into the bloodstream. They can be translocated actually into the brain. And so they're associated with adverse health impacts in a variety of different health systems. And some of the larger impacts that we'll talk more about are cardiovascular, but also they impact the respiratory system. They impact cognition. Recently, there was a nice article out of a group in Cincinnati about air pollution being associated with higher psychiatric admissions. They impact renal function. They are associated with diabetes risk, and also can impact the maintenance once someone has chronic diseases. They're associated with all-cause mortality. A lot of that is related to these other health systems. And they can impact future generations, both by impacting the reproductive system and by impacting the development of the fetus and birth outcomes. So to talk more about the cardiovascular risks, there's impacts of fine particulate matter, both very short-term variation, where exposure over days or even over hours can impact basically every health endpoint that we've studied. So harder endpoints like mortality or having an MI event, but also, people see impacts on heart rate variability, or there have been some pretty interesting studies that have used implanted devices and seen air pollution is associated with, for example, needing a defibrillator to step in on a very highly susceptible population. Chronic exposure is associated with even stronger impacts if you're breathing polluted air every day. And so a summary from the American Heart Association that came out said that for every 10 micrograms per cubic meter of PM 2.5, there was a roughly 10% increase in all-cause mortality. And the associations are slightly stronger when you look specifically at the cardiovascular mortality. So many of the deaths, the majority of the deaths here from chronic PM 2.5 are attributed to cardiovascular disease. And so this is a major player when we think about the environmental contributions to this effort that's been known as the global burden of disease, that's trying to account for how we should spend our resources in thinking about the attribution of causes and effects of disease globally, where most of the world has degraded air quality. And even in localities where we've been able to improve our air quality, such as in the United States, in the northeastern United States, where PM 2.5 had been getting substantially better, we now see that it's starting to get a little bit worse just in the past few years. So how does climate impact PM 2.5? Well, there's some effects of climate and specifically warming. So 3 that I wanted to mention here. One is that climate change can impact the frequency of inversions and stagnation events. And this can trap pollutants down in the area where we breathe. These inversions, mean that there can be a buildup of incomplete combustion byproducts, and that can lead to really bad air quality in the wintertime. So yesterday was a pretty stagnant day, and if you looked online, the air quality index was not so great in our area. And so that can mean that a changing climate can impact air quality year-round, not just during the heat waves when we think about, we really need to worry about the summer. However, we do have to worry about the summers also, because what you have is with warmer temperatures, with more energy in the system, that increases the formation of secondary pollutants. So that's where volatile organic compounds and other precursors of air pollution, they're interacting and they're forming new air pollutants. And that is accelerated, ground level ozone, for example, that's accelerated when you have more heat, when you have these heat waves. And so then you have the additional physiologic stress. Not only is it very hot outside, but also the air pollutant levels are higher. And third, something that we've seen in the news a lot is that a warming climate is contributing to the severity, the intensity, and the duration of wildfires. And we hear about wildfires happening in distant places, but because I'm going to come back and talk more about satellites, I like this case study from 2015 that was published that shows very nicely how fires that were very far away in Western Canada and Saskatchewan, they created aerosols that drifted across the continent. And we can see that these images are a sequence of days. On the left is the true color, and on the right is a product called aerosol optical depth, which is the density of particles in the atmospheric column as estimated by the scattering of light, which is a physics-based retrieval that NASA estimates. And what we see is that there was this intense movement of aerosol particles from Western Canada all the way across North America. And then there was a meteorologic event that led to downmixing. So this air mass that had been traveling up high, it came down over Baltimore. And so Baltimore had this exceedance of the expectations under the Clean Air Act, right, is that you're not supposed to have big air pollution events. And this wasn't really within the control of the people of Baltimore. It wasn't something that they had done. We don't really read in the news about what's happening in Saskatchewan. And so, over 3,000 kilometers away, they had this wildfire, and it was impacting East Coast air quality. So I think that's a very nice example. Obviously, the impacts can be even more severe for the people who are near the wildfire. There's direct impacts of wildfire. It's a danger to human health and habitation, but also it can create very high, intense concentrations of air pollution that are far in exceedance of what's healthy. So there's a great heterogeneity of exposure. I talked about how exposures can be impacted very distally, and they can change. They can also change very locally, right? It depends whether or not you're standing next to a busy highway, because some of the impacts of air pollution are extremely local, or it could matter whether you're in a community that was built, that had a bunch of highways that ran right through it. Because air pollution and temperature both change dynamically over time and space, we've been spending a lot of our efforts in trying to reconstruct it so that we can better understand how it relates to human health. So we need accurate estimates of exposure so that we can do better epidemiologic studies. And I'm an environmental epidemiologist, which means that we're thinking about how to relate these exposures with the health outcomes. And this has two pieces. One is on the exposure science part. How do we reconstruct what people were breathing or what they were experiencing? And then we'll talk a little bit about how do we link that to their health outcomes. So, devices that are needed to measure air pollution at the ground level, where we do all of our breathing, they're very expensive and there aren't that many of them. So this is a map of showing where stationary ground monitors are to measure PM 2.5. And it used to be that a lot of health studies would really only be able to include people that lived near one of those stations, because that's how we would assign exposure. You'd be assigned the levels at a nearby monitor, right? And then this grid that's overlaid, this is showing what you'd be able to represent if you could reconstruct the average within a 10 kilometer by 10 kilometer grid cell, right? And so one of the reasons that we use satellites is that they allow us to reconstruct what exposures were in a way that is continuous in space and in time, right? So that we can construct exposure estimates for everyone, not just the people who live near those ground monitoring stations. So what we've been doing is we've been taking data from satellites. Many of them are from NASA, some of them are from NOAA, some of them are from other organizations, other countries. The European Space Agency has some very nice satellites. And so we fuse this data together. I already mentioned that one of the products that we use from NASA is called the aerosol optical depth, or when we're trying to reconstruct temperature, you can use thermal remote sensing. So it's using the infrared part of the electromagnetic spectrum to be able to retrieve what the land surface temperature was, which is the temperature of the top few millimeters of the surface. So that's not exactly what we experience. We experience the air temperature, roughly 2 meters up, but there is a complex relation, but they inform, the land surface temperature informs what the air temperature was. So we're taking these kinds of satellite data and we're fusing them together. So an example of two of the models that we're working on in our lab here at Mount Sinai are for temperature and for fine particulate matter. Both of these projects we're doing on a 1 kilometer resolution. We've done the northeastern United States, so we have this region from Maine to Virginia, 13 states in the District of Columbia, and so this is on a 1 kilometer by 1 kilometer grid. So previously I showed you a 10 kilometer by 10 kilometer grid. So this is even finer with 600,000 or so grid cells over this area, and we're doing this for temperature. We're reconstructing every hour, and for PM 2.5, following one of the conventions that most of the monitoring is done aggregating 24-hour periods. We're doing it daily. So these models are generating billions of predictions, and then we can merge this, with where people lived, or which hospitals they're going to, where they worked, that kind of information. So this is some of the work that we've been doing with the satellites, reconstructing the air pollution, the temperature, that this exposure science can inform our health studies. So an example of what this might look like. So this is the New York City area. Here in the middle, we see this elongated island is Manhattan, and then the 2 points are contrasting a point in Brooklyn with Harriman State Park, which is a beautiful area outside of the city. And I wanted to show this because we're able to reconstruct that through a heat wave, there is this consistent phenomenon that the urban heat island is more extreme, meaning that the density of impervious surfaces and built up materials are retaining heat, and so that was showing that at the hottest point of the day, late afternoon, throughout this heat wave in 2013, that this area in New York City was always hotter than in an outlying park. But even if we go and we look at it hour by hour, we see that some of the biggest effects are actually overnight. So the city doesn't cool down. So the minimum temperature doesn't drop. That means that you don't get that physiologic respite. You don't get to recover. And we're able to reconstruct that. And let's see if I can get this one to play. So it's always hotter in the city, but particularly at night. And we see this for urban areas wherever we're looking, right? This is part of the urban heat island effect. So if you're thinking about different patient populations, it depends on where they live, how severe an ambient temperature exposure might be, and it also depends on these patterns related to the diurnal cycle. We're also doing a lot of fine particulate modeling. One of the models that we built is for Mexico City, which has a very large population with relatively higher air pollution levels. And an example of an epidemiologic association that we did is we looked at how those daily air pollution levels related to cause-specific mortality, where we saw that 10 microgram per cubic meter higher PM2.5 on a given day and the day prior, so averaging today with yesterday, was associated with a 3% higher rate of mortality from strokes. So this is an example of how having that exposure model, Mexico City didn't have a daily exposure model, has allowed us to then link that into something related to the health outcomes specifically in that locality. So we're doing this kind of effort where we're taking our exposure models, we're merging them into large administrative data sets. Now we're doing a lot of work with birth outcomes, looking at preterm birth, looking at fetal growth and birth weight for gestational age, doing some work on kidney disease, refining our exposure models, thinking about multiple pollutants, which is related to exposomics. So the urban heat island, I've mentioned a couple times what this phenomenon is and how it can impact cities, but actually, it's more like there's a lot of microclimates in the city, so it's more like an urban heat archipelago. And so we're starting to work with very high resolution land surface temperature from the Landsat program that's letting us identify very specific down to the neighborhood level, the block level, whether you're living somewhere that's hotter than elsewhere. So here, this is an inset on the right showing where Manhattan is, and then we're zoomed in on where we're sitting today. So this is Mount Sinai. And over here in yellow, this hottest area here, this is the Tuskegee Airmen MTA bus depot. So it's got black asphalt roof, and during this heat wave in 2010, that the temperature there was several degrees warmer than even just a few blocks away. And we see the cooling impact of having trees. Here there's trees between these large NYCHA buildings, and we see that having trees in Central Park is actually a little bit cooler than just the bare grass of the baseball diamond. So we're able to start to really drill down, and now we're going to scale this up so that we can reconstruct this over very large areas, because we have the ability to go back in time and leverage a very large collection of satellite data. I will add that ambient temperature is not the same as indoor temperature, and what people experience indoors can be meaningfully different. This is a really cool project that was done as a big collaborative study over the last few years. And by putting temperature sensor, by logging the temperature inside people's homes, in Harlem, they were able to show that when there's a heat wave, the indoor temperatures were more stable than the outdoor temperatures. They weren't cooling down at night, that the peak could lag behind when we thought that the heat wave had relieved itself. And so we do need to think about housing characteristics, particularly as we're starting to think about individual susceptibility. So I mentioned why we're doing this, and that we can start to also combine this with climate projections to think about what are the future implications for health of these environmental exposures. So last year at the Australian Open, which is around this time of year, they had introduced a new extreme heat policy where they had said, okay, if it's very hot on the courts, considering these different components of the wet bulb globe temperature, then we're going to potentially suspend play. But this year, during qualifiers, someone had to leave, because there was such extreme poor air quality. So there's lots of new directions that we're heading, particularly with the remote sensing. We're thinking about intraday variation from geostationary satellites that are collecting information on aerosol optical depth every 5 or 10 minutes. We're starting to think about components. The composition of the air pollution is very important to understand its toxicity. We can do more work on gaseous pollutants, more work on surface temperature. You can use satellites also to identify flaring or wildfire. We're doing a lot of work on greenness, which was mentioned as a component of positive human health, but also has a really important role in cooling, right? So there's an importance of having smart green growth, and we're able to use new satellites. So with that, I want to thank my group and wrap up.
So we have a few questions from Dr. Katie Strategos. The first one, you talked about understanding the variations in average temperature changes in different parts of the United States. Is there one part, the Midwest or the East, that has higher or lower temperatures than others, something to keep in mind?
Well, I think that the key take-home point is that the warming that we're experiencing is unequal. And so I would say that, urban areas are experiencing a lot more warming, particularly because of that urban heat island effect, and the impacts for health are going to be because their nighttime temperatures, they don't get as cool. So I would say that more than a regional, I would say that we need to be concerned, and then the most vulnerable in our society, they're also living in communities that haven't had the street trees. They're living in communities where more of the roadways have been put in, so they're more impacted by air pollution and they're more impacted by extreme ambient temperature.
Okay, and for the heat island effect, which you mentioned, the question is, how do you account for cooling related to wind proximity to air currents coming from the shore?
Yeah, so wind is an interesting factor, and we've done less with that because it's kind of hard to get at from satellites. So, when people think about the components of the wet bulb globe temperature, certainly if you're outdoors, wind, having air on you can change your ability to use evaporative cooling, so that matters. And if you were thinking about something like CKDU, and you have occupational exposure for people that are outdoors, maybe that's more of a factor. Kind of depends on what you're studying and how you're going to look at it. So, I also gave the example that what people are experiencing indoors, where they don't have wind, is very different in terms of their temperature as well. So I think it kind of depends what health outcome and what population you want to be studying.
So I would like to congratulate you all for your questions. We'll try to get through them. I think we have one more minute here. So the last question here, what is the source of highest resolution AQ data that the public can access for our region?
Yeah, so there's a website called airnow.gov, which sort of aggregates information from the EPA's air quality system. Those monitors are run by states and local governments, so we need to support them and push for more monitoring. But that can give you information about the air quality index, which is pulling information about more than a single pollutant, and I think that's an important concept. Even though I talked a lot about PM 2.5, we're being exposed to many air pollutants simultaneously. So I would encourage them to look at that website. But I think over the next few years, there's going to be more monitoring that's being done. The field is somewhat ambivalent about low-cost sensors. There are more low-cost sensors. They can be useful in drawing attention to areas that have particular problems, but they don't necessarily give the kind of accuracy in their data that you'd like for health studies. So maybe we can see advancements in that so people can get more neighborhood-relevant information where they live.
Well, thank you. And thank you for your questions. Dr. Just and his colleagues will be out there for lunch, so please feel free to ask them more questions while they're there. So thank you.